Hello, I'm Carol Musil, Dean of the Francis Payne Bolton School of Nursing. Welcome to the 2020 FPB Stethoscope Ceremony. It's been a whirlwind first few weeks of our fall semester. Believe it or not, you have been at CWRU for nearly a month, attending classes, wearing masks, and staying 6 feet apart from one another as much as possible. With our campus and our classes split between remote and in-person learning, this year is far from normal. The stethoscope ceremony, like most everything in 2020, is largely virtual. This week, during your classes, you received your first stethoscope and took the Nightingale pledge. We take this opportunity now to honor another first in your nursing careers, your first interactions with patients. Being a nurse, interacting with patients, it's more than a job. It's an honor and it's a privilege. Being a nurse is an invitation into your patients' lives and the lives of their families. You're a part of their lives when people are at their happiest, like the birth of a child. And you're part of their lives when they are most vulnerable, when they are incapacitated from illness or grief. As a nurse, your workspace is more than just a hospital room, a computer, a lab, or a desk. It's your patient's personal space. It's their physical being. It's their emotions, their coping, and it's helping them to find meaning in the challenges that they face. As a nursing student, and then as a nurse, you are invited into someone else's world. The stethoscope ceremony is a way to remind you to tread lightly, respectfully, and with purpose. Our purpose at the Francis Payne Bolton School of Nursing is summed up by our mission. We create nurse leaders who make a positive difference in the health of individuals and communities. Our mission is dedicated to interdisciplinary scholarship, practice, teaching, research, and service, and we are committed to the pursuit of excellence. As FPB nursing students and future nurse leaders, you're part of that pursuit of excellence. The faculty and I look forward to helping you continue the proud tradition of being an FPB nurse. Congratulations.
Good afternoon, everyone. I'm Dr. Amy Vita, Director of the BSN program at the Francis Payne Bolton School of Nursing at Case Western Reserve University. Welcome, class of 2024. Well, you completed your virtual university orientation, your virtual prepare to care orientation, and your basic life support and first aid training. You've had a few weeks of class, and now you're starting your clinicals. You're going to see real patients, real families, and real illnesses, and often, but not always, real recoveries. Your chosen profession is nursing, and it gets real. This is the very point where your college experiences start being very different from your roommate, if you have one, and friends around campus. First, all your pre-med friends start wondering if they should switch to nursing because they're not going to touch a patient for at least another 2 to 3 years. And at the same time, all your friends who are future engineers and writers and attorneys are spending their days sitting at a desk or behind a computer or in a lab, and that's okay. But your college experience is going to be completely different. Nursing students are among the lucky few whose classroom includes the patient's personal space, their personal lives, and the lives of their families. This is an incredibly unique learning experience and a true privilege. As a result of this unique privilege, you are required to have a different focus and awareness than your roommates and friends. When you put on that uniform and you use that stethoscope, your stethoscope becomes an extension of yourself. That is an extension of you. The stethoscope was invented in 1816 when the physician was uncomfortable placing his ear on a woman's chest to listen to her heart. So out of modesty for the patient, he created the stethoscope. It was actually a wooden tube, so he could have a personal connection to his patients and their care. This ceremony, the stethoscope ceremony, is a way to remind you of that personal connection. You need to tread lightly, respectfully, and with purpose in this unique learning environment. It's also to remind you that part of learning is to help others. including how to help yourself. Ask questions when you don't understand. Go to your advisor when you have a concern. We, your professors, your clinical instructors, your advisors, we are here to help you not only to be great nurses, but you are the generation of nurse leaders. It is a big responsibility. Today is one of the first steps we will take together in that journey. It is a lot of work, but it's also a lot of fun. Best of luck to all of you.
Hi everyone, my name is Aaliyah Clements. I'm a third-year student here at the Francis Payne Bolton School of Nursing, and I am the 2020 to 2021 president of the Undergraduate Student Nurses Association, also known as USNA. I want to start by congratulating all of you for being here. You're at a very important time in your life and you made such a huge accomplishment. I remember sitting in your seats, maybe not in the new HEC building, but still, I was so excited for all of the opportunities my future here would hold. I was excited about my classes, excited for clinical, I was excited about what color my stethoscope would be. I remember listening to the USNA president at that time giving his speech, and I remember feeling so overwhelmed about these next 4 years looming in my future. Looking back on all of my experiences from my stethoscope ceremony until now, I feel so grateful and so accomplished. And I can guarantee you all that as long as you continue to be the strong-willed and hardworking people that I already know you are, just by your being here, you will feel the exact same way. Now I want to jump into introducing USNA. The Undergraduate Student Nurses Association is a student-led organization here at Case Western. As a student group, we are able to advocate for one another and help improve the student experiences within the program. We're able to aid in the communication between students and faculty. We connect students through all years of the program. We're able to take part in the creation of state and national level health resolutions as students. And we love planning events for everyone within the nursing school to enjoy. Yes, even the faculty. All of you are automatically a part of this organization just by being students in the nursing program. So all of you are able to take part in the amazing things this program has to offer. And one day, one of you will be in my place and you'll be able to think back on how this program has benefited you as well. And you'll be able to tell all of the new students how excited they should be about it. Although hopefully conditions will be so that you can give the speech in person and not have to record yourself multiple times until you get it just right. And now back to your experiences at Francis Payne Bolton. I'm sure that all of you are so excited to see what these next 4 years will bring. And I'm sure that some of you are feeling overwhelmed and nervous about what these next 4 years will bring. But speaking from experience, all of these feelings of excitement and agitation and maybe even a little bit of fear, they are going to remain with you throughout the entirety of the nursing program. Maybe that seems a bit scary, and sometimes it is, but hold on to these emotions and utilize these feelings as they are going to turn you into great nurses. Every negative moment during nursing school will always be replaced by moments of pride. When a patient or nurse is frustrated with you, it always becomes worth it when a patient or nurse tells you that they appreciate you. When you're staying up super late on a Saturday night trying to finish a care plan while your friends in different majors are out at a party, or when you're waking up before the sun rises to get to clinical while those same friends are sleeping in until their 10 a.m. class. It always becomes worth it when you can apply the knowledge that you learned from that care plan to a patient in that early morning clinical. And when you get back that exam that you studied so hard for to see that you got your first C or even your first B, do not let it waver you, as that single grade will not determine how good of a nurse you will soon be. I know that your first year has been a bit unorthodox, and I realize that this has caused you even more stress than you already would have. But right now, around the world, there are people relying on nurses as if their lives depend on it, because they do. No matter what is going on in the world, nurses and students alike are going to be pushed to their limits. But that's the thing about nurses and the people that make them. They never give up, and they are all a force to be reckoned with. Remember to use these strong emotions within all of you to conquer all of those obstacles within your path, because to change one life for the better is to make a difference in the world. Congratulations to all of you again, and I wish you all the very best.
Introducing the Francis Payne Bolton School of Nursing BSN Class of 2024. Ronnie Hadenga. Karina Aguilar, Sofia Arroyo, Christina Baki, Logan Bergert, Grace Caldwell, Christine Call, Avery Campa, Lorraine Chen, Caroline Cole, Celia Daigle, Afia Dankwa, Rachel DeHaan, Elizabeth DeVoe, Aaron Edgar, Noor Weiss, Annika Fillion, Samuel Fox, Honor Fuse, Valeria Fuentes, Gabriela Galvez, Grace Gao, Rosemary Haskett, Connie Ho, Rebecca Holloman, Lane Hooper, Jennifer Wong, Skyla Hizola, Alana Jackson, Ariana Jefferson, Hannah Kim, Rebecca Kim, Esther Koo, Gianna Lambert, Claudia Larson, Lisa Liu, Renee Liu, Michelle Lobo, Sydney Maxwell, Yongshan May, Isabel Myers, Mia Morgan, Olivia Nelson, Fernanda Peralta, Sierra Petties, Kira Pisano, Annalise Probeck, Camila Ramos Rivera, Grace Reed, Cassidy Rescoral, Abby Riak, Anne Rutecki, Izzy Santana, Vanessa Shand, Emma Scheidlauer, Rachel Shen, Tiffany Shu, Amanda Slusser, Ashley Smith, Connie Song, Ashley Sue, Rowan Talmadge, Margaret Terry, Sarah Tressler, Haley Catherine Vaca, Nicholas Valenta, Kimberly Versells, Lear Wang, Madeline Whitus, Garrett Wong, Jane Wu, Arale Zapien, Dominic Zappatelli.
I solemnly promise to live my life honorably and morally, and to practice my nursing profession faithfully. I will never intentionally harm anyone in my care, and I will work hard to practice nursing safely. I will never take or knowingly administer any harmful drug or therapy. I will do all in my power to maintain and elevate the standard of my profession. By active engagement, a commitment to caring, continuing education, and mentorship of new nurses and nursing students.